having some delicious sparkling rice cooler. Not soju, not sake, but rice cooler. And we're gonna have some spicy cheese corn dog, which I've never had before. Some yummy crabs. I hope this is a soft-boiled egg. We'll soon find out. Otherwise, and that's a chicken egg, by the way. Then we have some yummy kimchi with the quail eggs that is fermented in yummy sauce, along with cucumber, baby cucumber. Then we've got some green onion, sweet red pepper, and some fresh cucumber, baby cucumbers. And there's a piece of garlic in there. For our pièce de resistance, we've got some yummy noodles, some fried mushrooms, that corn dog, and some leftover meat. So with that, let me shut up and eat. After you subscribe, of course.
Oh, good. That's good to hear. That's good to hear. Man, keep up the rehab. Keep going. Good luck to you. That's great. And that was just one of the best things that's ever happened to me as an ER doctor. It's one of the coolest things I've ever been involved in.
My throat's already getting cold. So again, let me shut up and eat.
Dr. Slade from Farmline 1.
Who is it?
Lab.
Oh, I've been waiting for this call. Hi, yeah, Bob Slade, hi. My heart was beating out of my chest when I got the call from the lab because I knew what they were going to say. How much? You're kidding. You're kidding. What about the cookies? Once the answer came, it just hit us like a ton of bricks. Listen, thank you guys for doing that lab so quickly. I really appreciate it. Okay, thanks.
There's a scald over there. Let me stick it in my brain. Stick it in.
Josie, I really can't say yet, okay?
Bob, I ate no sushi. Don't you?
The arsenic levels just went off the chart, so it was loaded. It's called metallic trivalent available in pesticides. It's arsenic poisoning. It was only in the oatmeal cookies, the vitamin cookies. It's not in the macadamia cookies. And it would seem that maybe the fat guy could very easily have acidic of the oatmeal cookies.
This is your dog's poisoning her husband?
This is a woman who overwhelmed people with kindness, who would order pizza for the late night staff of the ER, who would bring in candy and flowers and cookies to everybody.
Are you going to tell him?
Oh, hi Denise.
Doctor, I'm going to go bring in back some homemade soup. He hasn't eaten anything tonight. Anyone like some? It's chicken noodle.
I already ate, thank you very much.
I'll bring some anyway. Would you let me know if things change?
Of course I will.
Thanks.
In the ER setting, if you suspect homicide and any kind of foul play, it's by law the requirement that you report those suspicions. Police report is initiated and/or investigation according to the police. Colonel. Hey, Tom. Listen, we got the test results back. It's arsenic poisoning. We have proof. You remember your nails?
Yes.
Those white lines? That's arsenic actually deposited in your nails and sent it down to the lab. And it's also in the oatmeal cookies.
What exactly are you trying to tell me, Doctor?
We think your wife's trying to poison you with the oatmeal cookies.
Well, my wife, Doc, can be a pretty hard-headed woman, you know. Maybe she's trying to put me out of my misery. I don't know. I'm not really ready for that. Just, I'll talk to her.
You've already gone to the authorities.
Me and my wife, we've been married for a long time.
But it's
Settle this with her.
pretty much it. He decided then he didn't want to talk about it anymore. Agree, we're not eating more of the Oreo cookies. There were rumors that there was a
Oh, I just spilled my drink.
policy. I don't know that. We never got to the motive.
Guys, how do you feel about people go
I
in your stuff?
think that
God, I
maybe
hate
he
thieves.
had lost his
Hate
pride.
nosy people.
He wasn't what he used
So
to be.
irritating.
Enjoying life, I thought. Maybe she didn't think so.
There. It's feeling much better now.
Good luck, Thomas.
Click like and subscribe. Cheers. Oh yeah, babe.
These are the real stories from the ER that doctors never talk about.
Let's back up. My patient's not breathing, and I'm wondering if he's aspirated cow feces into his airway. All of a sudden, I hear this commotion. I thought I'd seen it all, but it is shocking. This was a first.
I need to get back to work. Can you get this thing out of my face?
Are you hurting somewhere? Do you have a heart condition? That's hysterical. She's just out of control and can't get it back. What patient? I don't die.
Hey, guess who's on TV?
Dr. Steve Bose was a combat physician in Iraq. Now he applies lessons learned in combat to the battlefield of the urban ER. One of the most important things I learned in the military is to think first, act next, and then stay focused on your mission.
Copy that. Out.
What's coming in?
Motor vehicle collision. Auto versus cow.
When a car hits another car, it's auto-auto. When a car hits someone crossing the road or a pedestrian, it's auto-ped, cow. And in this case, auto versus cow. So initially, I thought, okay, this is a car accident victim. We see, hundreds and hundreds of these every year. However, what looked like mud did not smell like mud. And having been in combat in Iraq, having taken care of many, many trauma patients, I've smelled many foul odors, but this was beyond all of that.
Patient's name is Barry. He's driving a convertible on a back road and smashing a pair of humping cows.
Humping cows?
Yes, exactly. Doing it in the middle of the road. One of the cows rolled on the bed and landed on our guy, and as you've noticed, defecated.
Unfortunately for Barry, cows have a pattern of defecating with high speed and volume. We have multiple lacerations. There's glass embedded in some of the wounds. He's penetrated by glass. He has multiple puncture wounds from the windshield breaking and puncturing his skin. We'll need antibiotics and a tetanus shot for these. That's even amplified more by the fact that each one of those wounds is covered with feces.
Aw, come on, guys. You're dropping cow crap all over the place.
Hey, you think this is bad? This is your truck.
Don't worry about that, man. We'll get that cleaned up later.
Thanks, Doc. I owe you.
Actually, you can start repaying the favor right now. Everyone was focused about the smell, the feces on the floor, but we had to stay focused on the mission. We had to stay focused on trying to save this patient's life. Let's roll him to trauma. I need your help cleaning up the patient, please.
We're still on break.
Grab some fans, and Jody, get a lot of soap and water and betadine. We'll meet you in trauma. How's his blood pressure?
Borderline, it's at 90.
When the blood pressure is that low, that usually means that the patient lost blood somewhere. But the paramedics reported that there wasn't much blood loss at the scene, so I was concerned that perhaps internally he was bleeding. Blood sounds are decreased on the left side. We better get a portable X-ray stat. After the initial ABCs, I'm concerned about getting an X-ray to check if this patient has a collapsed lung or any other internal injuries.
Doctor, he stopped breathing.
ER Dr. David Myers has recently landed a job at an elite private hospital.
Dr. Myers, good morning. What is this? I've never experienced this level of demand for perfection from the emergency department staff. That's my treatment report. Is there a problem with it?
I shouldn't have to tell you if there's a problem with it. You read it again, carefully. Then you tell me.
Mom, you cannot tell me let me finish. I don't know exactly what you're saying. You said it 10 times in the last 2 minutes.
Mine. At that time, 2 women entered the emergency department, and it was clear that there was a conflict going on.
So embarrassing.
Good morning. I'm Dr. Myers.
She can't breathe.
She can't listen.
I quickly became aware that the daughter had almost insisted that the patient come to the emergency department for her complaints, and the patient herself kept saying,
I'm fine. I don't know why you brought me here.
let's take a listen.
Of course, out of breath. She practically dragged me
Mom,
here.
just be quiet and breathe.
Breathe in, please. How can I do what he wants me to do? You keep telling me what.
Mom, nobody cares. Shut up.
Okay, listen. Everybody needs to take a deep breath. I'm going to have to ask you to leave the room. You're being very upsetting to your mom. I'm sorry.
I'll be right outside.
I always like to have family support at the bedside, but in this case, it was interfering with the care that I was about to deliver to her mom.
Sometimes she forgets who's the mother and who's the ungrateful child.
Yeah, the chief complaint at that time appeared to be some weakness and shortness of breath, very common complaint for patients at our hospital. Well, I'm really not seeing anything on exam that concerns me. I'm just going to order some routine tests just to be sure.
Thank you, doctor. That's what I thought.
And we're going to get a CBC, CMP, chest x-ray, and EKG, and some cardiac enzymes.
Excuse me?
It's all very routine, I assure you. We just like to be very thorough here. You order a chest x-ray to make sure that there's no pneumonia, fluid in the lungs, anything like that. You order a set of cardiac enzymes because sometimes shortness of breath can be due to a cardiac condition.
In the mood for Chinese food? Ginger Beef has been offering quality food and excellent customer service for over 40 years. Whether at one of our multiple locations or at home on a Friday night, let our staff treat you to a meal you won't forget. With great quality, value, and delectable Chinese cuisine, stop by or call any of our Ginger Beef locations around Calgary today. Ginger Beef, traditional Chinese cuisine with a modern twist.
Ask your doctor if Mounjaro is right for you.
Gordon Ramsay himself is going to be cooking our meals.
Jeff, what are you guys doing here? No.
I got a stadium with the greatest players of all time. Serena Williams, Aaron Judge, Cristiano Ronaldo, even David Letterman. Good luck. We actually got Madison Beer to go on a date with Nolan. How's the weather?
How's the weather?
All right, Tom, you can turn around. That happened so fast.
Well, you fellas behave yourselves.
Hey, you better not throw that dirt on the floor.
Pretty sharp, huh, Dan?
No. Gibson told me to resubmit it. I've gone over it 5 times, and I still have no idea what's wrong with it.
I need you in bed 7.
So let me call you back. Miss Larson, how are you feeling?
Tired.
Tired? More tired than when you first came in?
I don't feel right. I think I'm going to die.
Why do you say
I
that?
think I'm going to die.
Are you having pain? Are you more short of breath? And let's get her on oxygen. We should order a D-dimer. Miss Larson, take some deep breaths. Miss Larson? All of a sudden, she rolled her eyes and started to become unresponsive. I got this horrible feeling that something terrible was going on, as it was, and I couldn't imagine what I had missed. She's not breathing. Her pulse is weak. Let's start bagging her. Miss Larson, I'm going to call a code. Code blue, bed 7. Code blue, bed 7. Start bagging, please. Okay, let's get her the trauma bay now.
Comes to superstition, ER Dr. Tyler Smith is a confirmed skeptic.
Full house. You know what they say? It's a myth. Trust me on this one. They've done studies. The conventional wisdom out there is that full moons make fools of news, and that full moons brings out people with odder and more unusual problems. We can't blame it on the moon. It's a myth. Trust me. What's going on?
This is Kelly. 32, vitals are normal.
Normally, crack heart patients, are they level 1, 2, 3, 4, 5? A level 1 patient is dying. A level 3 patient needs to be seen within 30 minutes or something bad can happen.
Let me die! Just let me die!
Friends found her doubled over on her living room floor.
If somebody can yell that loud and that much, you feel some comfort that they're not a level 1, but you also know that they need to be taken care of. Are you hurting somewhere?
That's my heart.
Your heart, do you have a heart condition?
No! My heart is broken. My heart is broken.
Let's get her a room. Pay two. They call an ambulance for a broken heart?
Apparently. She was like that the whole way down.
Thanks. I'm getting a little irritated because she's louder than everyone else, so I've got to skip over the people who look sicker to deal with the person who's louder, who's more in your face. We do the basic triage. We get the temperature, pulse, respirations, and blood pressure, and she's going to get an IV, so we have some control and some access. Kelly, have you been drinking or done any drugs?
Well, she hasn't even been to work. She never was from Randy Williams in the same place.
It was clear she hadn't gotten out of bed, and there was starting to be an odor. So I was wondering, is this all emotional? Is this status hystericus? Is she just out of control and can't get it back? Kelly, how long has this been going on?
It's been a couple weeks.
Let me die!
Guys, I'm gonna ask you to step out to the waiting room.
BP is 95 over 65.
Let's give her lorazepam 2 milligrams IV, and let's get a CBC, chem panel, and get a drug alcohol screen also. So this was clearly unusual. I felt comfortable that this wasn't a level 1, this wasn't a level 2. She wasn't gonna get worse the next 15 minutes, so I had some time. Kelly, is there any chance that you're pregnant? Why are you crying? Kelly, we're gonna take good care of you. I don't think there's anything medical. Doesn't feel medical, doesn't sound medical. She's telling me her heart is broken and she's upset. Carlos, instead of trying to one of the psych rooms, let's focus on keeping her safe for now. I'll call upstairs to psych. I thought it was psychiatric, which meant I need to get some basic tests, do a basic evaluation, but really get her to the psychiatric unit where she can be treated and evaluated appropriately for her problem.
Hey, Doc. What's going on? She okay?
I'm sorry, you can't be back here.
Why won't you tell me? Is it about her family?
There's nothing to tell.
No, she told you it's her heart.
He was getting up against me. He was pushing me. He really wanted her to be taken care of right away. We're still trying to get more information. Give us a little bit more time.
You gotta get back in there.
Calm down.
She's gonna make herself die just thinking about it.
That's not technically possible.
You know, I was reading about
Start to stutter a little bit.
I was reading about it online.
Starts getting stuck. Starts stopping his voice. Starts
fluttering his eyes, starts twitching a bit. You okay?
Oh, man. Oh.
And he goes down. Now I've got two emergencies on my hands. Can I get some help here?
Oh.
Your hands off of me.
I thought I'd seen it all, but this shocked me. This was a first.
Let's get her to trauma bay now.
Dr. Myers is a new doctor at a hospital that demands perfection, and he's under scrutiny by his superiors. His inpatient's crisis isn't helping.
Having a relatively healthy patient come in, arrest in front of me, gave me the most horrible, sinking feeling I've ever had. Still no response.
Miss Larson, can you hear us?
Let's give milligram of atropine, please.
Still Brady on the monitor, 40.
We're gonna get ready to intubate her. I'm gonna need to accommodate who sucks. I'd like the video scope, please.
Video scope on the ICU.
Max 3, we did everything in the book that you knew how to do. We had to place her on the ventilator for endotracheal intubation. Rhythm change. Refib. Start CPR, please. Continue compressions. Let's get ready to shot. The whole time I'm thinking, what could have happened? Unsynchronized biphasic, 200 joules, please.
Charging at 200 joules.
Everybody clear.
Clear. Shot.
Continue compressions. VTAC.
Tack.
There was no indication that this woman was any sicker than when she had walked in the door, and yet she was dying right in front of us. Lidocaine, 75 milligrams. A milligram of epinephrine, please. All these thoughts went through my head about how this is not a good outcome. It's going to reflect very badly on me. Defibrillate again at 200 joules. Clear.
And shocking.
We're going to give amiodarone,
Amiodarone.
300 milligrams.
Amiodarone given.
Shock when you're ready, 200 joules.
Clear. Shocking.
She's down to 87.
One more time, 200 joules. Clear when you're ready.
Clear. Shocking.
After about 40 minutes of these intensive resuscitative efforts, we couldn't get anything back. Her EKG had been completely flatlined. She's not breathing on her own. Okay, hold compressions. What's on the monitor?
AC Sully. Plot 1.
I went around the bed and asked anybody if they had any additional ideas. Nobody could come up with anything.
After filling the ER with a noxious stench,
Doctor.
Dr. Bose's cow dung-covered patient has stopped breathing.
Let's bag him. My patient's not breathing, and I'm wondering if he's aspirated cow feces into his airway or if he has internal bleeding. He may die quickly if he's not breathing. So my biggest concern is helping him breathe. He has some obstruction. Let's see if this helps. Good. Looks like he's breathing again. Assisted ventilation, please. And let's set up for intubation.
Doctor?
My stethoscope is covered in feces. It was a pretty nasty scene. So I'm focusing on removing flecks of feces from the nostrils and the airway to help him breathe easier. And then the administrative nurse comes in.
God, it's true.
She's heard the rumor that we have a patient covered in cow feces.
Why didn't you clean them off? It smells like a feedlot in here. You can smell it all the way down the other end of the hospital. Patients are complaining.
We have bigger problems right now to deal with. He stopped breathing a few minutes ago. I see multiple broken ribs. It'll be a miracle if this guy doesn't have some sort of internal injury from a 1,500-pound cow landing on him. No collapsed lung, but sometimes you don't see a collapsed lung on the chest x-ray. We'll need a CAT scan to figure out what's going on.
Get your hands off me. I'll sue you all.
And all of a sudden, I hear this commotion from a new arrival.
What's that? A horrible stench.
Get a CT of the head, C-spine, chest, abdomen, and pelvis in the trauma panel. I'll be back.
Barnyard. Are you treating animals in here? Yuck, get your dirty hands off of me. Calling security.
Ma'am, will you please come into the bay?
Oh, look, you guys got private booths.
Unlike the first patient who wasn't talking, this patient is clearly talking. Her airway works.
Dr. Tyler Simmons has one patient complaining of a broken heart and another who's having a seizure.
It was a crazy situation getting crazier. We got one patient with a broken heart and another with a panic attack. Let's get him in a gurney. We were pretty comfortable. We knew what was going on with him. We had to turn our attention back to the patient with the broken heart.
He's placed her in the psych ward for observation.
The psychiatric rooms are separate from the other rooms because a lot of times people do yell and you want to observe them, but you don't want them in the middle of everything else going on. You want to give them a calmer environment, a more comfortable environment. Hey Kelly, how are you doing?
Terrible. Why did they move me here?
It's quieter. We gave you some medicine to help calm you down.
What about my heart? What about medication for my heart?
Tell me why you're so sad. I wanted to find out what could be so bad. What could have caused so much distress? And at first she's just saying, I can't get comfortable. Life is never going to be the same. What's going on? What's different in your life?
My dad. My dad died. 2 weeks ago, his truck rolled. Died at the scene.
Rice
He was supposed to
cooler.
be coming over for dinner,
Excuse me.
and he never came. Ever since then, nothing but pain.
She's holding her chest going, my heart is broken.
I need it to go away.
I wish that the pain of a broken heart was something we could fix in the emergency room, but it isn't.
While I was holding her hand, I was taking her pulse. And I feel an extra couple beats, and then it just skipped beats. Things just aren't fluid. They're not consistent. She's not in a regular rhythm.
Can we get an EKG on her whenever labs come back?
Just came in.
Thank you. Talk to you again later.
Her blood tests were normal. Her pulse was good except for a couple of extra beats. And there were no other cardiac symptoms. It had to be psychiatric.
Hey, my boyfriend needs to talk to you.
He's gonna have to wait his turn. We're pretty backed up out here.
There's something you need to know about Kelly.
Hey, feeling better?
Yeah, thanks. Missed a few doses of my meds there. Lesson learned.
You have some information to tell me about Kelly?
Yeah, there's some things we didn't tell you before. Kelly never left her trailer. Not once that we saw. And her place was filthy, right, Brandon?
For 2 weeks, they say she hasn't got out of the house. They said it was a mess. Bottles everywhere, clothes everywhere. It was clear she hadn't gotten out of bed. It was starting to go.
And she wasn't eating. And Kelly wasn't eating anything. That could be important, right?
She is pretty depressed.
No, I mean she was starving herself. We took her a few meals and she didn't touch them, except for the one ketchup sandwich.
She hadn't eaten. She may or may not have drank something. She hadn't been out of the house.
It was like she was trying to disappear. That's not incompatible with depression. There's a lot of grief that Kelly's gonna have to deal with. Her and her dad were tight. He was all she had. She doesn't have a mother or brothers or sisters or anything. She's not just sad, she's sick.
In here, like a hairball of sadness.
Excuse me.
They could tell something was wrong. They could tell something was different. There was clearly something going on, and we needed to figure it out. I get the EKG. And I said, this can't be my patient's EKG. My patient looks good. This EKG doesn't. It can't be my patient.
Are you kidding me?
Glad it came close.
Wait a second. I know you. You're in television. You're one of those celebrity doctors.
Dr. Myers has to speak the words no ER doctor ever wants to say.
Time of death, 11:21. I had no idea what had happened with her. We did everything in the book that we knew how to do. And where's the daughter?
In the waiting room, Mama.
I gotta go talk to her. There's nothing else for us to do. I felt horrible. We all felt horrible. was going on. I now had to go up to her and tell her that her mom had died. Dina, can you come with me, please?
Okay. What is it?
I just need to talk to you. This way. To have to deliver that news to the young daughter of a relatively young patient it's almost an indescribably horrible feeling. Dina, I'm afraid I have some bad news. Despite our best efforts, your mom has just passed away. I'm so sorry.
What? But how?
She suddenly stopped breathing. And a short time later, her heart stopped. We weren't able to save her. I'm sorry.
Are you sure?
It's a grief denial reaction. We do what we have to do to assuage that during this horrible time of a family loss. She understandably was beside herself, distraught, tearful, crying. It was a terrible, terrible feeling.
Can I see her?
We had done everything that we knew how to do. No idea what would happen. But the outcome was the worst outcome that there was possible, which is the patient had died. We have a grief counselor. We have somebody call for you. Excuse me?
You're inside.
To go from the lowest role that I was at to try to put on my doctor face again and take care of my other patients, I almost couldn't do it.
Dr. Myers,
Hey, what's up?
I don't think the patient's dead.
What patient?
The one who died. She's not dead.
She looked like a deer caught in the headlights. It was a look I'll never forget, and I'm sure it's a feeling she had that she'll never forget as well, too. The only thing I could think of was, what makes you think she's not dead?
I was taking off the leads, and then I saw her neck pulsating, so I checked, and there was a pulse.
I see multiple broken ribs. We'll need a CAT scan to figure out what's going on.
As the lone physician in the ER, Dr. Bose has just intubated a man crushed by a cow that defecated on him.
What's that horrible stench?
Now he's interrupted by a woman with a shoe in her cheek.
Get your greasy eyeballs off of me!
Having practiced and worked on the front lines of Iraq, I thought I'd seen it all. But this shocked me.
You want some of this? You're gonna have to pay.
As I said earlier, it's important not to get distracted by the chaos. To stay focused on the mission, which was treating the patient. No, thank you. But let's get you taken care of first. That's quite an injury you have there. I'm Dr. Bose.
Yeah, well, I need to get back to work, so can you get this thing out of my face?
She's pretty badly injured and pretty drunk. Deep breaths.
You guys fix my face, Doc. I looked through my living.
Clean her cheek, please. And I'll need some lidocaine. Thank you. So, who's the Cinderella? You have a sliver in your cheek.
Oh, Crystal. Bitch stole one of my regulars. When I told her to back off, she nailed me.
Lidocaine, please.
Wait a second. I know you. You're in television. You're one of those celebrity doctors.
Dr. Bose is a Bronze Star recipient.
Oh, I don't work at all, too.
No, I'm just on the news every once in a while to help injured veterans. Right now, I have to put a local anesthetic in your cheek. It's going to hurt a little.
Uh-oh. Well, whatever you are, you're cute.
Maybe we should check her vision.
Radiology's ready.
Thank you. We're going to wait for your cheek to get numb, and then we'll pull that shoe out. We don't have time to clean him now, guys. Let's get him to CAT scan. Go ahead and remove the water. Let's get the gurney ready. I didn't want to risk him bleeding out because we were giving him a thorough cleansing. Hang in there, Barry. We're going to find out what's going on inside you.
Are you insane? You're wheeling him through the hall like this?
Would you rather have him alive and stinky or clean and dead?
Radiology's gonna love this.
I couldn't believe that everyone was viewing this guy as some sort of pariah.
Whoa. What do you think? Can you bring me a patient in this condition?
We don't have time to clean him. He may be bleeding internally.
I'm not putting him in the scanner. There is no way. He's gonna mess up the equipment.
Get him out of here.
Seems your mom may actually want to die. I thought she would be angry, upset, or have all sorts of conflicting emotions.
She's alive.
Technically, yes.
She might be okay, right? It's possible.
Tina.
Go up there now and save her.
Whoa. What do you think? Can you bring me a patient in this condition?
Dr. Bose needs to get his cow-dung-covered patient to radiology,
Just get him out of here.
but the radiologist refuses to take him.
Would you rather have him in your scanner clean and dead or alive and stinky? We put him in alive and stinky.
There's no head injury, so that's good. Looks like left lung is getting looked for. She did show up in your x-ray, so no sticking there.
So he has a partially deflated lung that could be fatal if it decompensates further. The weight of this cow had hit his chest and deflated his left lung. And now the air was outside of his lung, putting pressure on the entire lung. He needs a chest tube. Stat. So we rush him back to trauma so that we can drain the air out of his chest and allow his lung to reinflate.
Don't tell me to calm down. Tell me where he is.
Ma'am, please lower your voice or I'll have
I'll
to
see
call
you guys in
security.
trauma.
Oh, what's that disgusting
Hi,
smell?
you must be Crystal.
Who are you?
I'll take care of this. I'm Dr. Bose. I'll get your other heel. So what can I say? Sometimes you have to do what you have to do to keep the peace. Have a seat in here, Crystal. I'll be back in 20 minutes. And remember, you have to stay calm.
You know, you look really familiar. Have you ever been to the kitty club before?
I'll be back. Have a seat.
Can you get this thing out now, honey?
2 seconds. I'll be back. We're getting ready with that chest tube? Let's prep the area between the 4th and 5th rib on the left side. I'll be back. New mission. Target a barefoot woman in the staff kitchen. Observe only. And don't let her back here where heel face can see her. Otherwise, World War III is going to start on your watch. Yes, sir. How's that cheek feeling?
My whole face is numb.
Open wide.
Why? Now put it in it, Doc. Oh my God! You just yanked it out. Any bouncer at the club could have done that. I thought you were gonna operate or something.
But the bouncer can't fix your cheek. You're going to need stitches. You have a hole in your cheek. Prepare for stitching, please.
Wait, give me that thing. I'm gonna give it back to Crystal. Right in their ugly face.
Sorry, has to go to pathology. I'll be back. I think the thing I remember most about that evening is how many times I said, I'll be back. Have this please back. I'll be back. So now I have to get back to trauma to reinflate my cow patient's lung. But first, I have to make sure that the team has cleaned all the feces outside of his chest so that I can make my incision. Even if a microscopic piece of feces enters into his body cavity, he could get a fatal infection. Looks good, scalpel, but he has a collapsed lung, so I have to insert a chest tube quickly.
What's wrong?
In the mood for Chinese food? Ginger Beef has been offering quality food and excellent customer service for over 40 years. Whether at one of our multiple locations or at home on a Friday night, let our staff treat you to a meal you won't forget. Great quality, value, and delectable Chinese cuisine. Stop by or call any of our Ginger Beef locations around Calgary today. Ginger Beef, traditional Chinese cuisine with a modern twist.
Like the vibe in here.
Ow.
Sound perfect. That's why I set them up with all kinds of tech to take the edge off holiday prep. Even the dog is chilling. Last year was a bit rough. This is better.
Find an amazing assortment of great tech for the holidays at Best Buy.
Fear Factor's back and it's crazier than ever.
TikTok Radio on Stingray Music is the perfect place to listen to the top TikTok songs living rent-free in your head. From your For You page to your TV screen. Enjoy all your favorites and more on TikTok Radio. Start streaming today.
Welcome to Stingray Music, where you can tune in to icons and legends who will rock your socks off. Stingray's classic rock channel features the very best tracks from artists like the Rolling Stones and the Eagles, as well as countless other fan favorites that have defined rock for generations past and present. Transform your day with an epic soundtrack and tune into Stingray's classic rock. Dr. Myers pronounced his patient dead, perhaps a little too quickly.
At that point, I raced back to the bedside, my heart beating. You're right, she's still alive. Start banging her, we're calling her code again. I couldn't imagine how that could be possible. She was dead by every criteria that we had. Code blue, trauma bay, code blue, trauma bay. I called everybody back to the bedside. I'm hyperventilating. And we reenacted the code again, listening to her lungs and her heart. I noticed she had a breath sound on her left side. Bang her slowly, please.
Very pale.
And her neck veins are distended. This indicated to me that she probably had a collapsed lung. And even worse, something called a tension pneumothorax, which is a collapsed lung under pressure that does not relieve immediately. Will squeeze the inflow and the outflow of the heart and cause the patient to die. In her case, die again. I'm going to need a 14-gauge needle now.
14-gauge needle.
And also set me up a chest tube tray, please.
Chest tube tray.
I placed it into the appropriate spot and heard that telltale gush of air that comes out as the tension in the air is relieved from the chest. Once that occurred, her vital signs actually began to improve a little bit.
BP's up, 100 systolic.
Excellent. Let's get ready to put that chest tube in. And so the next step would then is to place that needle with the tube to continually drain the air out of the chest cavity. Chest tube, which I did. Let's prep her to go to CAT scan. I'm going to order a CT angiogram of the chest. See if a blood clot in the lung has done this whole thing. So I ordered the CAT scan, but I was so worried about her, so amazed at what had happened. I decided to go out and give the daughter an update. She was still in the consultation. Dina? Dina, I have some news. It seems your mom may actually not have died. I thought she would be angry or upset or have all sorts of conflicting emotions. You see, we found a pulse in her neck. And somehow we were able to resuscitate.
She's alive.
Technically, yes. But someone who's been through what your mom just went through tends not to survive.
But she might be okay, right?
Oh.
Nothing, we can do it. It's a miracle. And now I know you're with my mom. I know I will. No! Lock her down and save her!
She crashed again. No pressure.
Would you like to come with us?
This isn't even an old person who's got high cholesterol, hypertension. This is not a 30-year-old woman with no symptoms. I look and I say, you got the wrong patient. I must have been a mix-up.
I don't think so.
This is not what she's in here for. She didn't say she had crushing chest pain going to her neck. She didn't say that she had shortness of breath. She just had pain. And it was 2 weeks.
Kelly, this is important. I need to know, does anyone in your family have any heart disease or any heart problems?
No. No risk factors. Nobody in your family had heart disease. Nobody had an early unexplained death. So there's no reason she should have any disease.
Any hypertension, cigarette smoking, high cholesterol?
No.
Nothing?
No.
It's just not making sense. So I tell the nurse to bring the EKG machine in and let's do it again. Because I want to see it myself.
They just did one of these on me.
Every picture's just a little bit different, and I want to see what your heart looks like now.
So I'm standing there with the nurse, getting another EKG, fully expecting it to be normal. And as it starts to come out, I'm seeing a big heart attack.
John Marin.
CT text on the phone. He says you instead of the chest tube wrong. What? He says it's in his
Dr. Meyer's patient has made an amazing recovery, only to collapse again. Now he's fighting for her life
What happened?
and his job.
She suddenly started descending.
Oh,
BP
no.
in the 70s.
I thought, my goodness, what else could go wrong on this particular patient? I felt horrible. I said, this can't be happening. All right, I need you to suction her tube, please. Let's start on norepi. Open up her fluids wide. Are you okay? Do you need to call somebody to be here with you? Okay. See, it was a wonderful warm feeling that I got from her that sort of re-energized everybody that we were going and trying to set them up for a second time.
John Marin.
CT text on the phone. He says you inserted the chest tube wrong.
What?
He says it's in his spleen.
This is so good.
Doctor says the patient has no
Elon.
symptoms of a heart attack, but her EKG shows she's in the middle of a massive one.
As soon as I saw the EKG, I said, this woman's in the wrong place. We've got to get her out of sight and into the main ear.
This
Where are they taking me?
Let me take a look at your heart, Kelly. You don't live 2 weeks with this kind of heart attack going on. We had to monitor. We had to know every minute what that heart was doing, every second, every beat.
We're doing the ultrasound to know what's going on with your heart. And as soon as it's done, we'll be able to get you some medication. Try and relax right now. We're getting all the information we need.
Full moon tonight. Not else but there. So what do we got?
30-year-old female, no cardiac history, labs are normal. All the hallmarks of a psychiatric crisis until we got the EKG.
Click like
Also,
for
she's
cheese
also
bro.
stressed about the death of her father.
So I get that echocardiogram, the sound waves are put on the heart, we look at the heart, and
I
we're
wish
like,
it could have
what's wrong?
what's
I don't
wrong
know what
in
it is.
there.
The EKG said MI.
This
This looks like heart
sausage
failure.
and then some cheese.
Look at this. Left ventricular base
I wanted
is
to end with the
hypercontractile.
cheese. It's
The
so
left
good.
ventricular apex is bulging.
I don't get it. She's depressed, but she's healthy. There's no reason she should have a large heart. Doesn't make any sense.
Maybe not to you, but I know what this is. Takotsubo cardiomyopathy. It's also known as broken heart syndrome.
Broken heart syndrome.
Hey, keep working on that backhand. My first coach was my dad, and one of the things I really appreciated about my dad as an early coach for me was the understanding that he had of consistent habits repeated day after day after day, and those habits have really stayed with me through my entire life, both on and off the ice. He's still my biggest fan.
Oh my God,
He's always
so
checking in,
good.
but now I'm also checking in on him.
Elon.
My dad has been living with
This is
type 2
so good.
diabetes for the last 15
I want
years.
you to
So
share
I gave my dad one of the Freestyle Libre 3+ sensors to see real-time data and build on good habits. I was surprised to see that my dad was pretty excited to use the sensor, and I think the ease of being actually understanding how to take care of his diabetes day in and day out. It's comforting to me to know that my dad has all this information at his fingertips. As an athlete and a doctor, I know that those consistent daily habits make a difference to your performance and to your health.
Escape into a world of endless beauty and travel to faraway lands. With Stingray Naturescape, your window into the world.
In the heart of Detroit's 8 Mile lies the city's biggest and baddest pawn shop.
How much money do you want?
Call Mr. Tips.
Well, are you ready?
Oh, so good.
Yeah, the most fun I had in ages.
Oh, so good. Yum. Chinese is so lucky. Me Chinese, me too Chinese, me too. Me eat your drink. So good. So good. Yum.
Looks good. Scalpel?
Dr. Bose needs to reinflate his cow dung covered patient's collapsed lung to save his life.
Shoot.
But there's a complication.
Looks like we missed a little spot that fell out of his armpit. We have to clean him again and get me some new gloves.
He's a mess.
There's a mess everywhere. The whole room smells. But I'm very concerned that area
I love this almost as almost as
if
much
any
as I
trace
love.
particles of feces enter into the chest wall, it could lead to a fatal infection. Scalpel? I make an incision. I insert a tube and hook it up to suction
This
so we can
matters
use the
like
air
cake.
that is outside the lung and the chest wall. This will help reinflate the lung.
It's better than
Now's your chance, boys. Clean him up.
a pancake. Oh
Don't
my
be
god,
stingy with
it's
the
so
Betadine.
good.
I gotta get back to the left answers.
There's more than one?
Got that yolk?
Then that fat slob said to me,
I want
call
that
that a lap
cheese
dance?
strand.
And I said, no, honey, I couldn't find your lap. I call that a belly dance.
Hey, Doc. Just doing what you said. I can see that.
So perfect.
Darling.
Maybe you should get some shoes that are easier to stand in.
Are you kidding, Doc? That would be the end of my tips. Guys love these shoes. And they make a good weapon of self-defense.
They do look pretty dangerous. Can you escort this nice lady out, please?
Oh no.
Come on my club sometime. I'll show you what I can do with these shoes.
Heck.
One mission accomplished. On to the next one.
I
She
knew
feeling up,
it.
Joyce?
I look like a line of Frankenstein.
Oh, let me take this off of here.
Let's get you stitched up. We ended up placing a total of 7 stitches on the outside.
It's some kind of fish sausage.
They won't be leaving a scar,
Ew.
just a beauty mark. Right
Oh,
about now, my
ew.
patient is completely clean.
It's a,
The
oof.
smell is gone,
That is some
and
vile
everyone
steak.
breathes a sigh of relief.
Dr. Bose's patient did just fine.
Taking him to ICU to watch for infection.
There's my hero. You are the best doctor ever.
Thank you, Joyce. You know your way out?
Are you going to come by the club? I'll give you a dance joint that you can get.
Oh, isn't that sweet? That's a very kind offer.
Make sure you come by, or I'll have to come back here and we'll use one of your booths.
Explain a lot. Drop the blood pressure, the heart rate, the breathing. It would kill him. Well, if you know what did it then. If this is true, I'm not going to be at my hospital very much longer.
Dr. Myers is trying to revive his patient for a second time when he gets some shocking news.
CT tech's on the phone. He says you inserted the chest tube wrong.
What?
He says it's in her spleen.
That's impossible. The spleen is below the lungs, below the level where it needs to be. first-year intern, unsupervised, might do that. My patient might die again. And I just began to have this sinking, horrible feeling that if this is true, I'm not going to be in my hospital very much longer.
Well, it'll explain a lot. The drop in blood pressure, the heart rate, the breathing.
It would kill her.
Well, at least you know I did it then.
Tell me what you're looking at.
Okay, right here.
Did you do coronal images? Let me see those.
There.
There. That's a broken rib, probably from the CPR. I don't think that's the chest tube.
Oh, sorry, you're right. That's a rib.
Thank God. Please have the radiologist call me with the reading.
Yeah, right away.
When the radiologist called, told me that the tube was not in the
What a
stomach,
shame that
resurrected my
tastes
hopes for
gross.
my career at the hospital, and also resurrected my hopes that I'd do okay with the patient.
BB's 95, SAS 96. She's stabilized.
Well, looks like she's doing better. How are you doing?
That's good.
How are her vitals?
Heart rate, BP, pulse ox, all normal.
Miraculously, she had resumed almost normal vital signs, although she was still completely unresponsive, which is not unexpected after having been coded for so long. Why don't we get her prepped to go to ICU? I figured that was certainly the last time I would probably ever see her, regardless of her outcome. Either she would die, or she would perhaps be in a persistent vegetative state. Here you go. Oh my goodness. And the most amazing sight I've ever seen comes into view. It was truly a miracle. I could not believe what we were seeing, and neither could anybody else who was there that day.
We want to thank you for everything. We want you to know we appreciate the amazing work you did to save my life. This is an amazing hospital, and you're an amazing doctor.
Thank you. There are some things inexplicable by the rules of medicine. I believe that this is one of them. I believe there was some intervention, some force that caused this patient to be able to walk out of the hospital 100% normal, while at the same time changing from one of the worst cases I ever had to one of the most remarkable saves in my career.
Dr. Simon finally has an explanation for what's ailing his unhappy patient.
I know what this is. Takotsubo cardiomyopathy. It's also known as broken heart syndrome.
Broken heart syndrome. Broken heart syndrome is a hypersympathetic syndrome where the heart swells up from emotion. And when the heart swells up, it stops working efficiently. And that leads to damage. So it all started to make sense. She was having heart failure from her broken heart. So her heart was failing in many ways now. Not just psychologically, not just emotionally, but physically too. Once we knew what was going on, we had to move quickly. We had to get medicine on board. We had to take control of her heart. Do some of the things that her heart wasn't able to do anymore. The patient was admitted to the hospital. Hello there.
Hey,
How's the pain?
it's fading. At least the physical pain.
She was watched there for a couple days, and within a couple weeks, the same amount of time it took her to get bad, she got better. The heart swelling resolved. The heart failure went away. And she went back to being a healthy 30-year-old woman. Why are you crying? You don't expect a young, healthy person to have an old person's disease. You don't expect a person who comes in with an obvious problem to have an unobvious problem.
I need it to go away.
I had forgotten to focus on the interconnection.
This product
How
was
the body
made
is connected to the mind and
March
the spirit.
24th
How her thinking and her feeling could really
of
affect
25
each other.
when it
So it felt good
expired
to finally have the full picture.
March 23rd of 27.
Still lining up. Through a phone boom.
Okay. Anyway,
Oh my god,
practicing medicine for
so
22 years.
delicious.
Every year there are 3 or 4
I'm happy
cases
I had
I
it
don't know the
last
answer
because
to, I don't know what's going on, or I can't
It's
figure
kind of
out.
sweet.
Medicine is still growing and learning and expanding,
Oh my god,
and we don't have the answers to everything yet.
I don't know if it's the booze. Or the hot dog.
Hey, Doc.
Or my
Let me out.
yummy thoughts of
What do I
Elon
see?
Musk.
Look, I
But
learned something
oh
tonight.
my god, am I gonna
A
sleep?
broken heart really can be life-threatening. You were right. Well, what do you know? Hey, good news about Kelly. We're just heading down to her place to pick up some of her stuff.
You know, bathroom and makeup and stuff.
And we thought maybe afterwards we'd help her plan a service for her dad. Help her say goodbye.
Yeah, make sure she takes a bath too.
Good on both counts. Oh, moon tonight.
So good. Oh my god. Oh my god, I think I have a little buzz. This is the second time drinking on this.
Odds of a ski injury, 1 in 334. Odds of getting shingles, 1 in 3. We all help protect ourselves, even when the odds are long. What about when they're not? Ask your healthcare professional about shingles. In the mood for Chinese food?